hope you're well. I thought I'd just pop in and tell you what I'm going to be doing in the next hour. A lot of time treating everybody else's skin to make them look glowy, that I actually neglect mine in the process. So with that, I've decided that I will do myself a little bit of a treatment, which is one of the most popular ones, in fact, in our clinic, which is microneedling with mesotherapy. And the reason I did that is because I find that my skin does need a little bit of attention. It needs collagen production, it needs to have even skin tone, and it needs to have the pores being slightly reduced. And all of these tend to be tackled with microneedling. So it's an amazing treatment for a multitude of skin concerns, such as uneven skin tone, acne scarring, pores, shrink pores, and also what it's supposed to be is collagen production. So microneedling also stands for collagen induction therapy, and it involves basically insertion of tiny needles, either in the form of a roller or an electronic device, to induce controlled trauma. And with that, as a result, we will be able to control the wound healing process by increasing the level of the fibroblast production and collagen production as well. So guys, welcome back. So here I am, ready prepped, and my face is washed. I've got my gloves on, I've put an antiseptic on, and I've prepared my pen to do my microneedling. Now, I'm not going to do my forehead and take your time, but I will address the areas that I feel are of concern, and these are the nasolabials, the marionettes, and also the jawline. But I will work on the whole 2/3 of the face, and just make sure that I will increase the level of collagen production. So I've used my meso lines, which I actually applied on my face already, to create a glide medium. And now we begin. So these needles are traveling at a rate that is incredibly fast per minute. I couldn't even tell you how many. In fact, I'm sure I could, but I'm sure I'm not going to bore you. And really the idea is to ensure that your punctures into your skin are done at such a fast rate in a vertical fashion. So as I begin to show you, I could go on to here where I'm creating trauma, which is controlled trauma. Now I could go into a horizontal lines, or I could go into the vertical lines, or sometimes you will see some people actually doing a rotational lines. Now, please do not try this at home for any depth for more than 0.25, and the reason being is that you need to make sure that this is done by a certified aesthetic practitioner in order to do this treatment. So at any other depth. You also will see that in some cases when you go, if it's at a deeper length, then your medical aesthetic practitioner will apply some anesthetic numbing cream, and they will then keep it on you for the period that's required. You have to bear in mind that these practitioners are there who are able to assess the time that this aesthetic cream sits on your face, because even though it's a topical ingredient, it does cross the skin and even can cross the systemic circulation, which is the bloodstream. And in some cases where people are on certain medications and they have certain conditions, this can be an incredible contraindication and can cause serious side effects. Now I am beginning now to start to feel the slight pain So I'm going to stop and add my meso line to the other side and continue on the other side. I'll see you shortly. Uneven skin tone and also pores, and it can be used for the neck, for the décolleté, for the body, anywhere. And it's actually sometimes can have similar results to laser resurfacing, and with minimal downtime. Right, so I now will go and get myself prepared for cleaning myself and wiping up any excess blood that I may have incurred on my face. So I would use always a clean gauze, a sterile gauze, because you need to bear in mind that our skin is open. So here, not much if you have a look, which is not the idea to cause a bloodbath. So when you see all gory, it all depends on the objective, and sometimes, to be honest, you may not need to be gory. So that is that. It's nice and clean. I haven't put any creams and stuff on. You have to be careful. You've got to have certain creams that you would put on your face because your channels are open, and you need to bear in mind that your creams and your lotions and potions need to be sterile, or in a packaging that allows it to remain sterile. So because your skin is open, and you want to make sure that your level of infection is totally reduced. So not all creams are licensed to be inserted to be applied at the end of the microneedling treatment. So now I'm going to be using my wonderful mask, which is a beta-glucan mask. Now I love beta-glucan because for me it's even better than hyaluronic acid. And I will be posting a whole post on why I love beta-glucan and what's the benefits of beta-glucan as opposed to hyaluronic acid. And those who are with me as my patients will always would have been told why I would prefer beta-glucan as opposed to hyaluronic acid. Now we stock this in clinic, and I do apply this for my patients in clinic, as well as it's available for purchase. It can be purchased as a single use, as this, which is a single use beta-glucan, or it can be purchased as a box. So either way, if you want to message me in Instagram or Facebook or email or give me a call, whichever way you want to communicate, we are able to then let you know how you can purchase this, and it's an amazing product. So I tend to cut it first of all. So we just need to get in there. So let's have a look. Now sometimes I think I just need to put my glasses on, but I am such a diva that sometimes I just don't want to put my glasses on. So anyway, we have comes in two sections, which is the eye section and the face. I've gone and so literally you need to put it down. Like, I need to put my glasses on now. I'm sorry, I wouldn't be able to see. Literally, you need to just make sure that you cover yourself. Of course, when you're lying down, this is so much easier when I'm doing it for you because you don't need to struggle. So that is absolutely divine. Absolutely divine. So now I'm going to use my magic wand. Before I do that, I can, yeah, that's it. I'm going to use my magic wand, which is amazing. And I'm just going to make sure I add the LED, and I've got the red light here to give me that extra boost. Of course, with this LED, you also have the heating element. Now what this beautiful device does, it allows and increases the transport of the ingredients into the skin, and it comes in a red light and a blue one, you see. And the blue one, you have an option of cooling the skin. So, oops. And you find, and this is, I'm doing it for demo purposes, this can go up to 10 degrees and it cools the skin totally. So you have options of the red light, which allows not only the red light but promotes the transport of the skin. Don't I look scary? Ooh. And also you have the blue light, and my patients adore this at the end of their treatment because it's part of their TLC moment. And I have to say, I absolutely adore it too. So I tend to use this quite often. And I can continue to do this until the mask is almost dry and it feels tacky and it's harder to glide. And this is part of our tools that we tend to use in the clinic, and it's available on purchase as well. It's one of our home spa tools that we are able to sell to. Hi guys, welcome back. So I hope you enjoyed the little overview of what microneedling looks like. So as you can see, my skin is fairly red. It looks like a mild to moderate sunburn, and that is absolutely normal. Now, what to expect from this treatment? Well, right about now, it feels, apart from it being red, it's actually feels fairly hot or warm and fairly tight. It feels like somebody's just pulled my skin all the way to the back of my ears. And that's really, really normal. Now, what do I need to do at this stage? Well, the first thing I need to do is not wash my face or rub it or create any astringents or peels or acids or anything that will really irritate my skin. The golden rule here is to make sure we hydrate. And so we're using an emollient that is neutral and it is incredibly hydrating. My face will start to peel, maybe not. It all depends on what the objective is. If my objective is just to transport ingredients of skincare at a low depth, then the peeling may not happen if it ever happens. The important part is that I have to make sure that I use a sun cream. That is a golden rule that should never be broken, that the sun cream needs to always be there. Otherwise, it's a mashup. We're not going to get a good look if we don't have any sun cream, because we have already created trauma onto the top of the skin and we are increasing the chance of hyperpigmentation. So it's a little of a whistle stop on what microneedling is about. So I will speak to you soon. Take care, bye bye.